Welcome. Let's talk about sinus congestion or sinusitis on CPAP. Now, it's important to differentiate between chronic sinusitis and acute sinusitis. Now, if a patient comes in with a chronic sinusitis and is about to start on CPAP, it's best to push the patient to use a full face mask instead of a nasal mask or nasal pillow. Another option is to have a patient referred earlier on to an allergist, pulmonologist, or an ENT for further evaluation. The next step is to assess the humidifier. Now, most machines nowadays will come with an inbuilt humidifier, and it's best to assess if the humidifier is actually working. One way of doing that is to see if the patient is required to refill the humidifier tank every few days. If this does not occur, that could mean that the machine is not working or the humidifier is not working optimally or not at all. The next thing is to do is have the patient increase or decrease the humidifier setting. Most machines will come with a humidifier setting ranging from 0 up to a value of 6 or 7. The higher the humidifier setting, the faster the water needs to be refilled. In addition, most patients will respond to increased humidification, which helps with sinusitis, but there are minority of patients which actually benefit from reducing the humidification. Now, this should be done every 1 or 2 days. The settings can be changed as to assess the best response for the patient. The third thing is to see whether the filter, the hose, and the water tank are free of residue and mold. Some of these equipment may be the cause of the sinusitis itself. Now, if there's any doubt about the functioning of the humidifier, it's best to write an order for the DME company to maintain or fix the machine. The next step, and I found some patients have used this successfully, is to consider the environmental temperature in the congestion that develops nasally. Now, sometimes in patients that live in temperate climates, the environmental temperatures may cause a loss of humidification between the machine or the tank and the patient. So one thing that I've noticed some patients do is they actually place the hose under the blanket. This minimizes humidification loss. Another thing to do is use an insulation material, and they've used thick pieces of cloth, wool, and so on to keep the hoses insulated. The third one is a climate control hose that's been developed by ResMed. Again, it can only be used by patients that have a ResMed machine, and it's best to speak to your equipment providers about costs, etc. The next option, and I mentioned this as well, is to switch the patient from a nasal mask or pillow to a full face mask. Now, there will be some patients who are resistant to the idea of using a full face mask, and if they have acute sinusitis that occurs sporadically or even seasonal allergies, they may want to purchase a full face mask separately while using their nasal mask or nasal pillows during the normal periods, and then switching to a full face mask during periods of acute sinusitis. This will help maintain their compliance to CPAP as well. Medical management includes various sprays. The effectiveness of the sprays will depend on what the cause of the patient's sinusitis is. One of it is the steroid nasal spray, and this would include Nasonex or Flonase, with Nasonex now being over the counter. Another option is an anticholinergic nasal spray such as Atrovan or ipratropium. The third option is to use nasal saline sprays, and such as brands like Ocean Sprays and so on. Now, it's best to use each one of them at least 2 to 3 weeks consistently to evaluate the effectiveness before deciding or changing to the alternative medications. It's also important to note that as well, brands like Afrin and or oxymetazoline should not be used for more than 3 to 4 days continuously, as it may cause a worsening of their symptoms. If this fails, an ENT evaluation may be in order, or the patient may need to consider other options apart from CPAP, such as mandibular advancement devices, which needs to be fitted by a sleep-certified dentist, weight loss, lateral positional therapy is an option, even surgery, upper airway surgery, especially if they have the anatomy for that. Now, there's a small subset of patients who suffer from heart failure or kidney problems, and if these patients have an issue with edema or fluid balance, this may actually cause a worsening upper airway congestion or nasal congestion as well, which contributes to their sinus congestion. And this can be referred back to their cardiologist or nephrologist for further evaluation. Thank you.